Hi, folks. Welcome.
Hi, everyone. Good afternoon.
We're just going to wait another minute or two for folks to trickle in, but I appreciate everyone for being on time. All right. Looks like we have a good number of folks on the call already. Thank you all for being here. I'm sure we'll have more people hop on. But just want to go ahead and start the meeting. Welcome, everyone. Thank you for being here today. This is the HMIS Policy Committee meeting. HMIS stands for Homeless Management Information System. If that's the meeting you intended to attend, you are in the right place. My name is Mark Mora, and I'm the facilitator for this meeting. I work for Homebase, an organization contracted by H3 to provide various types of support in the continuum of care, or COC in Contra Costa. Just want to remind folks that this meeting is being recorded. The recording has already started, and it will be available for public viewing after. Also, the live transcript function is enabled. I just enabled it now. You should see a note about that. You can toggle that on and off on the toolbar on your Zoom window, typically at the bottom of the Zoom window. So you can toggle it on and off as you need it. And then a couple other items before we start with introductions. I just want to welcome any new folks who have never been to a HMIS Policy Committee meeting before. And also want to welcome new Council on Homelessness members who are members of this committee. And of course, anyone else who's here for the first time. So the HMIS Policy Committee is a committee of the Council on Homelessness, and council members recently selected which committees they'll take part in for 2022. And so there are 6 council members now on the committee, which is great, and I'll allow them to introduce themselves shortly. And moving forward, though, we're going to try to do a better job in general across the various Council on Homelessness committees to remind folks of Brown Act rules. Brown Act pretty much dictates that meetings be accessible and transparent to the public. There's a whole lot of really detailed rules, but we're not going to really get into that. But one such rule I just want to mention is a rule called quorum. Quorum necessitates that at least 4 of the now 6 council members in this committee be present in order for the meeting to occur. So please, council members, be sure to give advance notice if you cannot make a meeting so we can plan accordingly. Lastly, I want to remind folks that we've recently rolled out a new way to do introductions to try to save time since we're only together for an hour. So we're going to continue that new format. So the way this will work is I'm going to allow the various folks who support the meeting to introduce themselves. So it'll be folks on the red team, on the coordinated entry team, and then council members. And then after that, I'll mention some other categories of folks, and then those people can introduce themselves in the chat. So with that, I want to open it up for the red team to introduce themselves. We can start off with Kim.
Hey everybody, Kimberly Tai, HMIS System Administrator, working under the H3 Red Team.
Thanks, Kim. Is Jamie here, or is Jamie not attending this meeting today?
So Jamie is out today. She will not be attending.
Okay, let's go to Tammy. Are you on?
Hi, everybody. My name's Tammy Stosich, and I am the Quality Assurance and Training Coordinator under H3.
Thanks, Tammy. Go over to Carlos.
Hello, I'm Carlos. Nice to meet you, everyone. I am the data programmer and analyst at H3. I'll be working with all this data and making the dashboards that we use to pull this data.
Thanks, Carlos. Tori.
Hi, everyone. Nice to meet you. I'm a data specialist for H3 Red Team.
Awesome. Thanks, Tori. Go over to Dana.
Hi, I'm Dana. I am the planner evaluator for H3.
Awesome. Did I miss anybody else on the red team? Okay, that is the red team. Now to the coordinated entry team, Shelby.
Hi everyone, Shelby Ferguson, Coordinated Entry Manager for H3.
And there's no one else on the coordinated entry team, correct?
Nope, you're good.
Awesome. And now we're going to go to council members. Is Tony here?
Hi everybody, Tony Gasperi with the Housing Authority of Contra Costa County, and I hold the PHA seat on the Council on Homelessness.
Awesome. Thanks, Tony. Is Gabriel here? Okay. What about Iman? Okay. Joe.
Hi, everyone. Joe Bruno here, currently the consumer seat and vice chair on the council lived experienced expert.
Glad to have you, Joe. Juno.
Hello, everybody. Juno here, Juno Hedrick, chair on the Council on Homelessness and also the youth representative. Nice to see everybody.
Thanks, Juno. Is Lene here? Okay, I think it's possible that one or two of the other council members will hop on later. So thanks for everybody introducing themselves verbally. Then for committee member organizations, so members who are participating in HMIS, if you could introduce yourself in the chat, that would be great. So I'm putting a list of all of the committee member organizations. If you work for one of those organizations, please introduce yourself in the chat. Welcome, Fadi and Marjeline and Alex. Thank you for being here. And then for any folks who are work for non-HMIS participating agencies or members of the public, feel free to introduce yourselves in the chat now as well. And please, if you're able to see the chat, you can get a sense of who's in the room today. So thank you everybody for introducing yourselves there. And with that, I will move us to the next item, which is public comment. This is an open period for members of the public in attendance to comment on any items not listed on the agenda. So if you want to make public comment, you can go ahead and raise your hand or unmute or drop something in the chat. So go ahead, opening the floor for public comment. All right, not seeing any hands raised and not seeing anything in the chat. We will keep it moving. Closing public comments. We're adding this, we've added this agenda item. This will just be a quick thing that we'll include moving forward. Just wanted to provide some space. If anybody has had a chance to review the meeting minutes from the previous meeting, which went out with materials for this meeting, if you have any edits or even questions about anything on the meeting minutes, you can mention that now by unmuting or throwing a comment in the chat. So just any questions, edits, comments about the previous meeting minutes. Okay, not seeing anything. We will move on to the next item, which is agency updates. So any HMIS participating agencies can inform attendees of any updates to staffing, programming, operations, or other events. So if you have an agency update, go ahead and either raise your hand or throw something in the chat. Any agency updates? All right. I see in the chat, Dana, would you like a PIT update now, or is there a designated time later? There is a PIT count update, which is agenda item 8. So is it okay that we save that for later? Awesome. Thanks, Dana. No other agency updates? Either there wasn't a lot of changes going on, or maybe everyone is just aware of all the changes that have happened. No need to update. Okay, well, if you think of something, don't hesitate to put it in the chat. All right, I'm gonna move us to the next item, system administrator updates. I'm gonna pass it over to Kim.
All right, cool. Thanks, Mark. Awesome job. So just a quick update. We have the system-wide performance report that the red team is working on now, preparing it for submission to HUD. You may have received some requests for cleanup, specifically around missing move-in dates, missing annual assessments. We ask that you please make those updates before the 25th, which is when we'll be running everything. And then final submission is due the 28th. We will also be providing an analysis of the report after everything has been cleaned up and we've wrapped everything for the submission. So you can expect that probably by the next committee meeting. And then the second thing, all DV data is now reconciled and in comparable databases as of January. So, yep, good job, everybody. Is there anything else? All right. That's it for my updates.
Awesome. Short and sweet. Thanks, Kim.
Yep.
Any questions for Kim before we move on? All right, no questions. Next is
I have a question.
Oh, go for it.
Kim, but the assessment, how can I do the assessment for people that's no longer that I discharged from my shelter? I'm having a hard time accessing that. How do I do it, their assessment, annual assessment?
Great question. I think we should talk about that offline because I'll need to see the data that you're working on. If it's over, I think 3 years old, we can probably do without it. The SPM is focusing on the last 3 years.
Yeah.
So we'll look at your data, Steve, and maybe schedule a time.
Thank you. Yeah, because some of them is from 2012.
Oh, okay. Yes, let's talk about that for sure.
Thank you. Thank you.
Yep.
Thanks for your question. All right, moving on to data quality reminders. Pass it over to Tammy and Tori.
Thank you, Mark. Can you go to the next slide, please? And we'll have Tori start us off.
Okay. So one thing that we have submitted to us every month is something called the monthly client enrollment report. It gives a comprehensive look at all of the admissions and discharges to a program or programs within a month. And that allows the agency administrators and program managers to see and reconcile data entered into HMIS with their other records. To try to help with that, we came up with a kind of tracking system. We're going to be sending out an email notification to let everyone know that it's going to be due about 2 weeks before. We'll also be opening up conversations and support if anyone needs help with either running it or submitting it or correcting it. We actually created another workflow guide that shows how to run it and has tips to correct it on it as well. Let's see, other updates that the notifications would be sent out for is if you submit it and it needs corrections, if the due date passes and it wasn't submitted at all, there will be like an overdue reminder. Let's see. And then the next slide. So part of what the workflow guide helps to do is look at some of the HUD data quality parameters that we're working with right now. That would be the completeness, accuracy, consistency, and timeliness. So on the bottom of the workflow, we created like a little tip sheet that has those parameters and what kind of errors you might be looking for if you're checking your enrollment report. So are there any family members that are disconnected from their households? Are there any blank spaces on the enrollment report, like someone doesn't have a VI or there's no move-in date reported, or somebody's been left in the program for too long and they haven't been exited yet, making sure that services are up to date, things like that. So we're just trying to open the door for documentation and communication for all of this information, because a lot of this goes into common data errors that we find when we do other cleanup as well. Any questions on that?
And just to remind everyone, this is a report that's already we've already implemented this process. This is years. We've used this process for years. It's just now we have a tip sheet to go along with how to run this report, what to look for specifically. So we hope that that's helpful for everyone. And I think the report should be submitted to the H3 Red Team email address. Is that correct, Tori?
Yes.
Okay. Got it.
Okay, thank you, Tori. And for my update, this is Tammy. For my update, I want to show everybody a new feature that is in Clarity. It was an updated feature for removing exit date and exit data. So I'm just going to give you a quick demonstration of the feature and how you can use it. Oops, what happened? Let me share my screen. What happened? Oh, there it is. Okay, so I'm going to use Donald Duck for my example, and the only thing you need to do is go to your program tab and edit a closed program. So in this example, I'm using an old Monument Crisis Center enrollment record, and you can see that there's an end date record, so it's closed out. I just edit the record and go to the exit tab. And you can see on the exit screen, there's an exit date, there's exit data. And at the very bottom of the screen, there's a new link. It says reopen client program. When you click on that, a pop-up box will open. If you click on clear all data, it will remove all of your answers on all of your exit fields. If you don't want to remove the answers on your exit fields, let's say you're just updating annual assessments and you have to enter a missing annual assessment, you can just don't select clear all exit data, just click on save to remove the exit date. That will reopen your record, and then you can go to the assessments tab and add your annual assessment. Or let's say you needed to add services, it will open up your provide services tab to allow you to add services. And then when you make your corrections or whatnot, you can go back to your exit tab. And then you can scroll down and click on restore exit data. And it will restore the exit date. You won't lose any information, and you can click save and close. If you need to remove all your exit data, let's say an auto exit occurred and prematurely closed your client out of your program and you noticed it, you want to reopen their record and remove their exit data, you can click on reopen client program, clear all data, all exit data, and click on save. And then it will remove all of your exit data. Let's say you did this on accident, you didn't mean to clear all data. If you click on restore exit data, it will restore all your exit data. So you won't lose anything if you accidentally clear all your exit data, and then just save your changes. And so that's how you reopen a record that has been closed out. You no longer have to clear out the exit date and click save. So it's a new clean feature. And that's all I wanted to show you. Are there any questions?
I have a quick question. This is Jasmine.
Hi, Jasmine.
Hi. So that toggle feature, is that for every single program, or are those just for certain programs that the toggle is going to be there?
Well, we just enabled it for everyone. So not everybody had the full access rights to restore data, or, you know, versus just clearing out the exit date. So we've given everybody full access. So it should apply to all programs.
Okay, thank you.
Mm-hmm. Thank you. Any more questions? Thank you very much. Thanks, Mark.
Thank you, Tammy and Tori. Let me share my screen again. All right, we will keep it moving. So next is upcoming projects, data quality monitoring plan, and performance-based contracting. I will pass it over to Kimberly and Shelby.
All right, cool. So a couple upcoming projects. We have two big projects underway. The first one being the data quality monitoring plan, which I can talk a little bit about. And then the second project being the performance-based contracting project, which Shelby can probably talk a little more about. But the DQMP, or the data quality monitoring plan, is a supplemental document to the HMIS policies and procedures. HUD requires that every COC have a data quality monitoring plan. It establishes specific data quality benchmarks for our COC. It also identifies the responsibilities of all parties within the COC regarding data quality. And then it also establishes a time frame for monitoring data quality on a regular basis. So currently we are working with Home Base to create a draft plan, and the goal is to have a final draft for this committee's review by April. And then in the summer, we will officially be rolling out the plan. And the DQMP is in support of performance-based contracting, which most of you should be familiar with by now, but if not, we'll add a link to the chat. I don't know if Shelby, do you have that handy? Or Mark?
I can probably add it.
We will add it to the chat. But yeah, I'll hand it off to Shelby to talk more about that project.
Thank you, Kim. You all have probably heard lots about the performance-based contracting project that we're doing with our consultant, Elaine DeColony. So sorry if this is repeat information for some of you. As you know, through some program models, and we have 7 different program models: PSH, which would be permanent supportive housing, rapid rehousing, rapid exit, emergency shelter, our care centers, outreach, our core teams, and prevention diversion. So those are the 7 program models that we're working on right now and requesting feedback. If you could go to the next slide, Mark. In ways you can send in feedback, we're offering multiple different ways depending on your learning style. So you can submit just a generic email to our Contra Costa COC email account of any feedback you have on these models. We did have a public meeting on February 1st where we went through these models, broke out into small groups, but no, it was a lot of information to digest. So if you have had a chance to look at those and you have feedback, you're welcome to email it. The other way is the survey, which is now live. So I can link that here in the chat in just a second. And then finally, we did have some very specific office hours for contract providers, which some of you have attended. Thank you so much for attending those. And we completed those today. But then we also will have one more opportunity just for the general public and community to attend an office hour on February 22nd. So that'll be next week from 10 a.m. to noon. And I think the link also went out for that, so I can pull that too and put it in the chat. But yeah, so you'll have multiple ways to give your feedback if you have any. But if you have any questions, you'll feel free to reach out to me. I can also put my email in the chat as well. Thanks, Mark.
Thank you, Kim and Shelby. Any questions?
Yeah, so sorry. I have a quick question, and I'm so sorry I'm asking this a little bit late because we went over the reopening the program on HMIS. So I understand there's that new feature. I was just wondering if there's a way we could include that when we go to the head of household and we reopen the program, that it allows us to reopen the other members of the household as well. Recently, we did something that was requested from the red team, and had to open each program and each member of the household in there, versus going just to the head of household and reopening the program and kind of selecting, how many other members we wanted to open. It allows you to do that obviously in the exit screen when you want to exit everybody, but to reopen, would it be possible for something like that to be included?
Thank you, Sadiq. That feature is not available with this new update, but we can definitely make a recommendation to our vendor to see if it can be a future update, but currently it's not, unfortunately.
That's all right. Thank you.
Sorry.
No, you're okay. I'm just trying to see if I can nickel and dime you guys as best as I can.
But we'll definitely bring up the suggestion.
Please, yeah, thank you.
Any other questions to Kim or Shelby about data quality monitoring plan or performance-based contracting? All right, not seeing anything in the chat. There is actually the link though for the to the survey for the COC program models. There's a link that Shelby dropped in there. All right, we'll keep moving. Next is pit count updates. Is that to Kim or to Dana?
I can give I can give an update. I don't know if Kim has a different update around the shelters and stuff. It's actually going really well. We're a week and 2 days away, and as you know, we've been working with the contractor, and so some things are different. Many things are very similar. What is different is how people are assigned to different census tracts, but we've got almost all of our volunteers assigned to tracts, and we are no longer, sorry, I'm doing this for Jamie. I don't even know what's on the slide here. So I'll make sure I've covered everything on here, but I was just gonna wing it and say, I've been very focused on the volunteers. And so We have just enough volunteers. We could use like backup folks. So if you know folks that still need to would like to volunteer and be involved. We've got, I think, 240 census tracts that have been covered, and it's going really well. We are finalizing the survey. The survey is in line with a lot of the other communities in the Bay Area. So we've been working with the data work group for the Bay Area, and so we feel good about our questions. It's nice that we're going to have a little more consistency with other communities. And we are finalizing some things around, we do have some folks with lived experience that are going to be helping us with both the survey and with the point in time count. So from that perspective, from the sort of unsheltered canvassing count, that's the update I have. I don't know if Kim has thoughts on the shelter piece.
Yep. So Dana and Jamie are taking lead on the unsheltered count. However, myself and my team will be taking lead on the sheltered count, which measures how many people are in shelters the night of the 23rd. Is there anything before we jump into sheltered count stuff on this slide, Dana, that you want to talk about?
No, I forgot to mention, there's going to be some communication. So again, we're working with the contractor. So it's been a little bit different. They have helped us realize that our county, particularly Jamie and I, over communicate, but you're probably feeling very in the dark because we're working with this contractor. So now you're going to start getting some communications. You're going to hear from the Dana and Jamie crowd you'll be getting information about your assignment. Well, so let me back up and say, quite a few of you on here have volunteered. So I'm talking to you guys. I really appreciate the communities and the service providers that have provided volunteers. So there will be communications going out with a route, what you've been assigned to, a hold harmless statement, which is just sort of a, yes, you won't, get mad at the county if you get a flat tire while you're canvassing. And then their training surveys or training videos have been provided as well. So it's been quiet, and it's just because it's been a new process, but some of these items that are on here and will be communicated more clearly in the next couple of days. That's it. Thanks, Kim.
Cool. Thanks, Dana, for that update. All right, so the sheltered count is for shelters and transitional housing projects only. If you are a provider that is in HMIS, then all of the necessary information will be run out of HMIS on March 14th. So we are asking that all data entry for the month of February is completed by March 10th. For providers that are not in HMIS, we will be sending an Excel tracking sheet tomorrow if we haven't sent one to you already. The final report for the sheltered and unsheltered count will be available. ETA is midsummer because we still have to crunch the numbers and do that demographic and geographic analysis. So the ETA is midsummer for that. Next slide, please. All right, so this is talking about the housing inventory count, which also happens the night of the pit count. So we will be sending a Google Doc to all agency administrators and non-HMIS participating providers tomorrow with some instructions. Here is an example of what you can expect. The housing inventory count is looking at how many beds were at each facility on the night of February 23rd. So if you can confirm that your project is listed there, that the type is correct, which the type would either be emergency shelter, transitional housing, rapid rehousing, or permanent supportive housing. And then also make sure that the funding sources listed are correct, if any. And then it goes into the number of beds. So how many beds are dedicated to families, how many beds are dedicated to single adults, and how many are for unaccompanied youth. So just in a nutshell, that's what you can expect to see on that spreadsheet. Next slide, please. So on or before February 24th, please ensure that all the information and all beds and programs operated by your agency is reflected on the spreadsheet. if you operate an RRH program, the number of beds is defined as the number of beds available for use the night of the 23rd, which is usually equal to the number of people moved in that night, usually. Unless, of course, you have a unit that's available and the family or the individual hasn't moved in yet. For voucher-based PSH programs, the number of beds is defined as the total number of vouchers, whether they are in use or not. And then for site-based PSH, this would be the number of beds on site. So that's just a quick summary of what we're looking for on the housing inventory count. And you will receive these instructions most likely tomorrow. All right, I think that's it. Did I miss anything else, Mark?
Nope, I think that's the last slide of this section.
All right, cool.
Thank you, Kim and Dana. Any questions from folks?
Hi, Mark. This is Khaled with Shelter Inc. What's the significance of doing the spit count on the night of February 23rd or 24th?
Sorry, did you ask what was the significance of the pit count on the 23rd and 24th?
The significance, when I say the significance, meaning the date that has been chosen to do this.
We should have probably said that to begin with. I forget who's heard what already. So normally it's done at the end of January. We would have actually done this by now, but communities all across the country and particularly the Bay Area pushed it back to get past the Omicron surge. So it's usually done at the end of January, and that gives us 3 months to complete the data, get it cleaned up, submit it up to HUD. HUD has not allowed us to turn our data in any later, but they did let us do the count a month later. And so I think every Bay Area community waited until end of February instead of end of January.
Awesome, thank you very much.
Sure.
Thank you for your question. Any other questions? All right, we are rolling along. We only have a couple items left. So next is emergency housing voucher updates. I will pass it over to Shelby.
Thanks, Mark. Okay, next slide. Thank you. So just want to give a quick update on the emergency housing vouchers. For those of you who haven't heard and might be interested, Contra Costa with our local housing authority of Contra Costa was awarded 201 total emergency housing vouchers. That was back over the summer. Our community chose to prioritize 2 groups for those vouchers: long-term shelter stayers and people in permanent supportive housing who are ready to move on. So far to date, we've sent 80 referrals to the housing authority, and of those, 65 households have already received their vouchers and are actively searching for housing. So that's really great news. We're well on our way. And most importantly, this is the first voucher program that we have that's tracked in HMIS. So really exciting. And hopefully that will be our new trend. Thanks, Mark.
Awesome. Thanks, Shelby. Any questions about EHV updates?
I have a quick question. This is Sarah. Hi, Shelby. Do you have a breakout of how many of the vouchers that have been awarded are PSH versus shelter at all?
I sure do. Yeah, so we just, looks like we just finished up with PSH, and it seems like we'll have about 65 of those vouchers will be going to PSH Move On. So that's the number of people in PSH who are eligible and interested in moving on.
And as part of the process of that whole world, I was wondering about the deadline and the cutoff. I know that we were needing to manage to use these in a fairly rapid amount of time, but I was wondering if there might be more PSH people that were interested but didn't make whatever the cutoff was.
There's not at this time. The cutoff for PSH referrals was last week. Of course, we have some of the snowflake ones that we've talked about that we've kind of put on pause. But yeah, as far as getting new referrals, no, we're not able to push it back another month. So yeah, the deadline has passed, unfortunately. Any other questions?
All right. I don't see anything in the chat. So thank you, Shelby. Okay, we are at our, well, second to last technically, because the last one is the quick adjourn slide. So we're at Q&A. Any questions about anything covered today or any questions otherwise?
This is Tony. I have a question. You know, we've been talking about this whole transition of the rental subsidy program to HMIS through Hope Solutions, and there's some work being done to clean up some software to transfer everything over. Is there any you know, guidance or written standards that we can look at and review and discuss with not only the red team but also Hope Solutions and try to kind of expedite things on that?
Hey, Tony, it's Kim. We did some initial research and I think we sent some of our findings to, I think you were CC'd on that, but let me check, to both Hope Solutions.
Yeah.
So there is HUD guidance around whether, what the best way to move forward would be. And I think doing a project transfer is easiest. It wouldn't involve any work for the providers. It would just mean that BitFocus has to change where the project sits in the back end. So I think the initial estimate they gave was between 3 to 5K for that one-time migration. And I think if we are good with that number, we can move forward and they can start drafting the statement of work, which will involve.
We are, as a housing authority, we are good with that number.
Okay, then I can expedite that process and let them know that they can start writing the specs for this project. They haven't given a time estimate yet, but I know I think the contract starts April 1st. So we'll be sure to prioritize that.
The contract actually starts March 1st. I think there's an overlap and H3 is exiting at the end of March, but Hope Solutions is coming on board and as of March 1st, and they're going to shadow.
Got it. Okay, even more of a reason.
Yeah.
Okay, even more of a reason to get it expedited with BitFocus.
Right. And I know that you guys are elbows deep in the pit count, and that's equally important, if not more important. But if whatever we can do to make that move along, that'd be great.
Okay, great. So if you're okay with the numbers, we're gonna go ahead and push that, give them the green light to start working on the script for that.
Great, thank you.
All right, thanks, Tony.
All right, any other questions?
I'm not sure if this is the place to ask it, but I'm curious on, and I think this conversation has happened elsewhere, but how does somebody connect to the HMIS network if they're a new organization or a new group, or like if they're, how do you get involved in this side of it, like that technical side of it, and using the program so we can use that data?
Great question, Joe. So I could speak to that. We usually have COC participating providers access our HMIS. So there is an application on our website. It's, I think, called a HMIS access application form on our site. But in general, they have to be participating in the COC first. So
got it. That's good to know. That's great to know. Thank you.
Yep.
All right, any last questions before we move on to the last slide? Okay, not seeing anything in the chat. Thank you all for your questions. And we will adjourn the meeting. The next meeting is going to be on Tuesday, March 15th from 3 to 4. But thank you all for coming today. And I'm happy to report that you get 15 minutes back in your day. So please enjoy.
Thanks,
Good job.
everyone.
Bye, everyone.
Bye.
Bye, folks.